Hello and welcome to the National Cannabis Prevention and Information Centre's first clinically focused webinar series. My name is Dion and I'm a research officer here in the clinical training team, and I'll be introducing you to the presenter for this webinar series. I'll also be moderating the question time at the end of the presentation. Please type through any questions you would like answered by today's presenter in the box at the bottom left-hand corner of your screen. This webinar series is designed to introduce viewers to the Adolescent Cannabis Checkup, or ACCU, which is a brief intervention consisting of an assessment and feedback session. Last week, viewers were introduced to the intervention and its background, as well as the first session, the assessment session. Today and on Wednesday, we will introduce the second session, the feedback session. And on that note, please ensure that you've registered for the final webinar on Wednesday. As many of you are aware, Etty Madelon is delivering this webinar series. Etty is a clinical training manager here at NCPIC and has over 26 years of clinical experience working as a psychologist in the alcohol and other drug field. And she's been disseminating clinical workshops for NCPIC since we started back in 2007. Over to you, Etty.
Hi everyone, and welcome back, and thanks everyone for coming back and yes, listening to part 2. And I want to apologise. I'm not sure whether you're all the same people that were here last week. I guess I'm going to assume that you are. So I won't go over the stuff that we went through last week at any length. But hi and welcome back. So you've all met Eric, and he was our 23-year-old carpenter who still lived at home and smoked approximately 8 cones a day, has a girlfriend, and he was picked up very unlucky, DUI, and so was taken to the police station and blood tested and found to be positive for cannabis. So poor Eric, you get that. Now, you did the ACCU with him last week, and you may or may not have, at the end of that assessment session, decided to give him something to read, which would be something like the What's the Deal booklet that you can see there on the right-hand side. Again, that's entirely up to you and how you feel. You're the clinician. You've got to feel for what that person wants from you, and so you may have given it to him just as something to read. And thank you very much for your time, Eric. You've kind of ended it with, look, I hope this discussion has been valuable. I just need to go through everything that you've told me, and I would love to see you again next week for the feedback. Now, if he doesn't turn up, if by some chance, again, I don't know where you all work, but if for some chance you've gone through this assessment for an hour and he doesn't turn up for the feedback, you need to ask yourselves, has this been a waste of 60 minutes or 70 minutes or whatever it is? I suspect not. I suspect that Eric has never sat down and looked at his cannabis use in such detail before. So this should really make him think. At the very least, it should make him think or rethink, I suspect, his cannabis use, given what you've done in the last 60 minutes. So, you know, it's not the worst thing in the world if he doesn't turn up for his feedback session. However, should he turn up for his feedback session, I've given you a copy of the personal feedback report, as you can see, highlighted in red, that's been filled out, and we'll use that to have the remainder of the talk. Now, on the right-hand side, you can see personal feedback form. Now, those two need to be filled out in the ensuing days until he comes back. And they're identical to one another. The difference between them is that he gets the green one, and it's a slimline pack that can be folded and can be put very easily into a back pocket. And the other one is for your notes to keep with you. But when he comes back, you go through this together. You say, look, this is my copy and this is your copy, and you and I will go through these through this together. So, and then he takes his with him. Now, people have asked me previously, if he doesn't come back, should I post it to him? Well, again, that absolutely depends on you and where you work and the appropriateness of you doing that in terms of confidentiality and so on. So that's entirely up to you as to whether or not you post it if they don't come back. I suspect that what you might want to do is perhaps ring and follow up with a phone call and then get the okay from them. As you can see there's a black book there. That's called the Strategies Workbook. Now that is offered in the event that at the end of the feedback session, someone actually wants to come back and see you again and reduce their cannabis use. And what I want to say about the green and the black book, these can be ordered from us through our website, and the other one, the report, is downloadable through our website. You just print that off and keep it. However, the other two, just order them and get as many as you think you might need. You know, maybe 50. 50 should do you. Again, depending on how many people you see and so on. So they are the things that you need for the ACCU. Okay, again, it's very similar. Obviously, it's exactly the same as the assessment. So the headings are the same as you would find in the assessment. So the first page, as you can see, consists of those things. And the first thing that you want to feed back is the reasons for attending. And the aim really is to clarify for that young person or that person. And just while I'm on that term, young person, I can't remember whether or not I said last week that this isn't necessarily just for young people. It was simply that young people are the biggest group of non-treatment seekers. And we did this originally by getting them through significant others that came to see us for the pilot and for the randomised control. So the only difference between this and, say, our regular 1 to 6 sessions is that this is primarily for non-treatment seekers. This is primarily for people who haven't sought treatment for their cannabis use. So they don't necessarily need to be young people. It's only, as I said, that young people are the biggest group of non-treatment seekers as opposed to 30-year-olds who recognise that they should do something about it because, you know, it's a bit detrimental to them. So, so just bear in mind when we use the word young person, doesn't necessarily mean that they need to be young. So clarify with that person their reason for attending and where they're at with their cannabis use. It allows the person to have their current views of cannabis use and their stage of change discussed without any confrontation or any, you know, resistance of any sort. And so you might start off by saying, look, you know, would it be helpful for me, or if you could, it would be helpful for me if you could tell me again why it was that you decided to participate. And as we know, Eric said, well, A, I needed to, and B, I was a bit curious about what you were going to say about cannabis. So you need to just check that out and then feedback the stage of change. You said to me, for example, you said last week in the assessment that you were thinking about stopping or reducing your use of cannabis, but you didn't think that you were going to do that or begin within the next 30 days. How does that sound? Is that how you still feel right now? Again, you're just checking to see. And this is where, when we did the randomised control trial, some people actually said, well, I couldn't believe, you know, what we went through last week, and I actually stopped this past week. I haven't smoked. So sometimes, depending on their headspace and their age and so on, they may well have cut down in the previous week after having that discussion with you. So you never know. Then the next section is we were talking about good things about cannabis use, and that really you just want to explore the positives without assuming that it's a problem. It's never kind of referred to as a problem. And it's a really good way to start. It's not threatening. It builds rapport because they're talking to you about their favourite topic. and it just, minimises any kind of resistance that you might get. So when talking about the good things, you might want to say, look, last week you told me that it was relaxing, that it helps you sleep, that it's fun, it kind of, you enjoy stuff more and it feels good. It helps you escape from some of the stresses and arguments and so on. Now, when it comes to relaxing, are there other ways to relax, do you think? That's one of the questions that you might ask in a kind of open-ended way, or something else that you might say, how might other people relax? What do you think other people do as a way of relaxation? When it comes to helping him sleep, you'd say, so why do you think that might be? How do you think that kind of works, that it helps you sleep? Again, these are gems, really, to explore further and get them to really think a lot harder about, I guess, the reasoning behind that. Is it sound reasoning? And it just gets them really to explore and increase their awareness and their mindset. Then the other one was fun. And you go, it is fun. A lot of people say that. And when you say that it allows you to enjoy stuff more, well, yes, cannabis actually allows you to focus on certain things. It just heightens those senses. It feels good. Yes, a lot of people say that it does feel good. So you're not really at loggerheads. The person doesn't necessarily need to be defending their use. Must be good reasons to use, otherwise, people wouldn't do it. So you need to explore those, summarise them, feed them back, and ask open-ended questions to have a fuller discussion around those things in order, as we said, to heighten their awareness about why they're doing this and, is it a good thing? All right, then we get on to the next page, which is all about cannabis use. If I can actually go back a couple of pages back here. Now, can you see that there's a black question, any others? Where you see that kind of question, it's for you to ask during the session. It's not filled in between the assessment and the feedback. It's filled in during the session, during the feedback session, in order to kind of elaborate a bit more. All right, so getting now onto page 2, where you're now going to feed back their pattern of use. So you told me, Eric, that you started using at the age of 15 and that you now pretty much use every day, and you've been using every day since you were 18. So out of the last 60 days, and remember what I said last week, you don't need to do 60 days. You can do 30 days just so that it's consistent. But for the sake of the way it's written, but you could cross out 60 and write 30. So Eric, yes, so that means that you've used 60 out of the last 60 days. That's the last 2 months. Now the typical amount that you use is anywhere between 6 to 8 cones, and that's approximately 60 cones, which is approximately 300 cones a month. And when I kind of asked you, when you use and so on, what you told me was that you usually smoke when you get up, when you come home, and then pretty much until you go to bed. And that you usually smoke now at home on your own. And that you usually smoke on your own. From time to time you smoke with some friends, but basically when you get home. We talked about whether you tried to cut down before or not use before, and you told me that the longest period that you'd gone without was for a week. And then you would go on to talk about how much. And I might say something like, so I looked at how much you smoke on a daily basis, and I multiplied that, and I worked out that per week it's about 60, and per month it's about 300. And then I looked at, I multiplied that, per year, and then over the last 5 years. Now, FYI for the listeners, if, and I'll show you the timeline follow back. When you do the timeline follow back, as I said, you won't get the amounts exactly like 8 times, 7 days in a week. There are times where they smoke more. So when I added did his timeline follow back and added them, it came to more than 300 a month. It came to, let me just move forward and have a look at that. Oops, sorry. Oh, I haven't got it there. I did add it up. I think it came to something like 368 or something like that. And so I multiplied that, and that was 3,600 per year, not 3,000. The only point I'm trying to make here is, even though we rounded it up for the sake of these webinars, when you're doing it in real life, you probably end up with a higher figure than 8 times 7 times 365 times however many years. So anyway, I would feed back the amount usually used and say something like, so in the last 5 years, Eric, it looks as though you've smoked 18,000 cones. And pause. That's pretty powerful. And you can see the little cogs going, oh my God, chest, coughing, sick, oh, maybe. So whatever's going on in someone's head is exactly what you want. And then we talk about the amount of money. Now, that is very often the single most motivator on top of health. And so I might say, so last week you told me that you spent about $150 a week. And I multiplied that by a year, and then I multiplied that by the 5 years, and then I threw in the 3 years when you weren't a daily smoker and came up with approximately 40,000 or 50,000 or whatever it happens to be, and so on. So that's that component, and I'm just going to move on. So again, you want to review a person's pattern of other drug use. You need to compare that, and I'll talk about the normative data in a second. I'll show you what I mean by that. So you're talking about their pattern of drug use. You compare that with early cannabis use. You look at it in context of other people, i.e. the normative data, and it provides them with an overview and highlights the discrepancy between what they're doing now and what they used to do and how that's changed over the years. Now that is extremely important in terms of planting a seed. So you're looking at who, what, where, when, a timeline follow back. You may or may not want to talk about high-risk situations. You're looking at how much it costs. You're looking at quitting attempts. You're giving all that back, and you're talking about less good things, and then you're talking about risk perception. So you provide feedback, and you might ask, so what do you think of all that? What goes through your mind, when we talk about that? When I say things like whatever it is you've just said. So you're trying to look for problem recognition. You're trying to look for some statements. Oh, gee, I didn't think I was smoking that much. Or, gosh, I didn't realize it was costing me that much. And that's what you're trying to listen out for change talk. And when you talk about the normative data, when you kind of place a person within the general population, you're trying to point out the discrepancy between their use and others. And you're hoping that it kind of generates a sense of discomfort. And that's needed. So that really precedes any kind of decision to change, is that level of discomfort. you know, and it also undermines their sense, you know, that this is normal, that everybody does it. So you really need to say or show them where they sit within the general population and within the smoking population. So you really need age-specific normative data, and I'll show you that slide in a sec. And then you talk about, you explore with them how their cannabis use has changed over time. You know, so tell me a little bit about your early experiences with cannabis. So what was it like when you first started compared to how it is now? Now, again, this can lead to an increase in problem recognition. So that is kind of the reasons why you would ask these kind of pertinent questions. And just to move on, before I show you the video, remember the timeline follow back last week. It wasn't 8 times, 7 times, 30 days. There were times where he smoked more, when he got paid, and definitely on a weekend. Now, I just want to talk about normative data just for 1 sec. And this is a graph of people over the age of 14 in the population that have used in the last year. And as you can see, 10% of people have used in the last year in the Australian population. That's a lot of people. Just in the last year. It doesn't mean daily or whatever. We don't know. Well, we do know whether it's daily, monthly, or whatever, but that's just overall in the last year. So now what you really need is normative data that breaks down into, you can do it in gender if you want, gender, but definitely in age. So you need to get hold of, what I'm showing you is the 2010, but I believe that the 2014, well, it's actually 2013, but it's coming out in December. So get a hold of that if you want to, and break it down into gender and age. But if you don't want to do it in gender, then certainly in age. And for example, the 14 to 19 looks like this. And I think it's really good to feed back cannabis, tobacco, and alcohol because they are the most widely used substances. So those 3 are really, really important. And again, remember what I said last week was it needs to be their primary drug of choice. No point in talking about this if alcohol is their primary drug of choice in context of this ACCU, or if other drugs, heroin or ecstasy or whatever else. So when it comes to Eric, he falls into this 20 to 29-year-old category. And as you can see, cannabis ever used is a lot of people. And in the last year, it's 21.3% of 20 to 29-year-olds, right? 20% of 20 to 29-year-olds were used last year. And of those 21.3%, 12 used every day. So that's where he would fall in. Now, this may or may not come as a surprise to him. He might think that, you know, 80% or 90% of 20 to 29-year-olds smoke every day. So that's the data for 20 to 29-year-olds. This is the data for 30 to 39-year-olds, and this is the data for 40-year-olds. And this is both males and females. All right, so just to kind of recap this section here, this page, most of page 2, I'm just going to show you the video that I guess exemplifies how you might want to feed that back. Okay, here we go. Cue the video, please.
Okay, Eric, can I summarise what you told me last week so that I can make sure I've got it all right?
Yeah, sure.
Okay. So you told me that you started smoking cannabis at the age of 15.
Yeah.
And that by the time you were 18, you were smoking every day.
Mm-hmm.
Yeah. You've been using every day these past 5 years, and gradually that's increased to 8 to 9 cones in a day, which is approximately 60 cones a week.
Mm-hmm.
Yeah?
Yeah.
Okay, you usually smoke one as soon as you get up, a few hours before you start work, and then smoke again as soon as you get home up until you go to bed. And you used to smoke with your friends, but now generally you just smoke on your own. The longest period you've been without was about a week, is that correct?
Yeah, spot on.
Okay. So, okay, based on what you've told me, I did a rough calculation just on how much you smoke and how much you spend on cannabis. Would it be okay if I shared that information with you?
Yeah.
All right. Smoking approximately 8 cones a day. You smoke about 3,000 cones a year.
Far out.
3,000 cones a year. Right, that number surprises you?
Well, yeah, that's ridiculous. That's really bad.
So you don't sound too happy about that.
Well, no, that's 3,000 cones a year for 5 out of the last 8 years.
Yeah.
So that means 15,000 in total. That's ridiculous. Like, I don't want to think about that.
That was a quick calculation. Anyway, then I looked at how much money you've been spending, and remember how last week you told me that just on cannabis and tobacco alone, so this is not even including, that's the tobacco you mull up with, not including cigarettes, you said you were spending approximately $150 a week.
Yeah, that's right.
Okay. This means that in the past year you spent approximately $8,000.
No way.
In fact, this means that in the past 5 years you've spent approximately $40,000 on cannabis.
No way. I mean, that's... I never really added it up, I suppose.
Yeah. What do you think about that?
Well, I mean, that's horrible. That's just shocking, because that's a lot of money.
Yeah. And you're not okay spending that much money on cannabis?
Well, no, obviously not, because $40,000 is a lot of money, and that's $8,000 a year. I've almost never got money in the bank, so that'd be, you know, really good if I was spending that in the bank instead of on weed.
8,000 is a lot of money to you. You can think of a lot of other things you could do with that money.
Well, yeah, obviously.
Has it kind of got you thinking, you know, how nice it would be to have that money?
Yeah.
I'd also like to put your cannabis use in perspective. So I'm going to give you some stats. From a survey of people in Australia done in 2010, the stats suggest that young men in your age bracket, so between 20 and 29, only 20% have smoked in the last year.
Oh, well, that's a lot less than I thought.
Yeah, I mean, that could be, though, smoked just once, weekly, or every day. So that means only 2 in 100 people smoke as much as you do, like on a daily basis.
Oh, well, that's a lot less than I thought.
Yeah, it's actually only a really small number of people.
Well, I would have thought a lot more people would have been smoking, because all my friends smoke, so I thought it would have been higher.
Yeah, right. I mean, I can see it's news for you. I mean, you've been assuming that most people smoke because your friends smoke too.
Okay, so that's kind of basically how it's done. Now, I just want to go back to this slide. Now, what she omitted to say when she said only 2 in 100, it should have been only 2 in 100 of the entire 20 to 29-year-old population, or of people your age smoke like you do. So to me, it's kind of even, you know, more enlightening to think that only 2 in 100 smoke. So it's even less than 12%. So I just didn't want there to be any confusion about that. The other thing I just want to highlight is, and I'll show you in the next clip, or want you to listen out in the next clip for you know, asking permission, would it be okay if I gave you this information? This is MI kind of framework. To listen out for reflective listening, for, say, reframing things or double-sided reflections, and so on. So in the next clip, I just want you to kind of perhaps listen out for some of those things when she gives Eric the feedback. So I just wanted to clarify that little bit there about the normative data. Okay, so moving on, we've reflected or we've given Eric feedback on the pattern of use, how much he smokes, how much money he spends, how that compares to other people. We've fed back some alcohol and other drug use. I just want to also highlight one other thing. If they smoke tobacco over and above the cannabis and what they mull up with, you need to factor that amount of money in as well, what they spend on tobacco, because that makes that amount of money even worse. So don't ever forget to have a discussion and give feedback, not just on cannabis, but cannabis and tobacco in the smoking thereof and the two together, and also the money spent on cannabis and tobacco, because very few people just smoke cannabis here. So then the other thing, just to highlight, hang on one sec, bear with me, is when we talk about patterns and early experiences and how that's changed. So you do need to ask that question. And he may say something like, well, you know, I used to smoke with friends and I'd have a ball when I was younger, and now mostly I'm kind of like on my own. It started out every now and again, and then it kind of became daily these last 3 years. And so, you know, this is really time for reflection. You might then want to say, well, you know, what do you think about that and how do you feel about that? So as you can see, it's written there on your sheet underneath early experiences, that question that's written in black with spaces there. What do you think about that? How do you feel about that? Are you okay with that? Whatever you clinically feel is appropriate to ask. Try to make it an open-ended question. Then the next bit, as you can see there, is less good things about smoking. And what Eric said last week is that it causes arguments, causes friction, causes stress. It makes him feel like crap, and so on. And yeah, it makes me feel like crap, like the morning after a big night. And you say, so are there any other things that are not so good? He may say something like, and again, it's all very theoretical, depending on you know, how talkative they are. He might say something now, well, you know, I guess now that you're asking me, I guess, you know, it costs a lot of money. And if I really think about it, I guess I'm not enjoying it as much as I used to. It's kind of like more of a habit. It doesn't seem, if it's a habit, perhaps doesn't seem to have the same purpose as it did, which is to have fun. I'm just kind of, I don't know, doing it like a robot, like out of habit. Who knows? Whatever they say, it's absolutely food for thought. And you really need to preface it by saying, well, we've talked about the good things about smoking. Now I'd like you to look at the other side, the less good things, the not so good things, and so on. You said blah, blah. And then you might just want to feedback the risk perception. Eric, last week we talked about some of the risks that are related, that other people think, you know, are at risk of them using cannabis. And I asked you, you know, what you thought may be at risk in the future for you if you were to continue. And you ticked money, your physical state of health, lack of motivation, relationship problems, and impact on your work performance. Can you kind of elaborate on this a bit more for me? And let's for argument's sake, let's look at, this is between you and I out there in cyberspace. Let's just choose one. So why might smoking weed, why might that be a risk on your work performance, for example? Can you kind of tell me why you think that would be a risk, as though you didn't know? And again, you are looking for elaboration and some, hopefully, insights that you can jump on and expand even further. Remember, this is designed to increase awareness, and the only way we change behaviour is to increase our awareness and attempt change. All right, so the next page is looks at the SDS. Now the next page really tries to highlight and identify some of the negative sides of cannabis use. So when you've looked at the assessment, you want to pick out some salient things, some things that are important to Eric, some things that you, again, want to feed back during a feedback session. And they include, feedback on the SDS, other problems, as you've identified through the problems questionnaire, health issues that may have come up, the K10, any social issues that you can see in terms of conflict and what have you, and we'll just look at that in a sec, and any legal issues, and of course there's the DUI that he was picked up on. Now with the SDS, as you can see, this is what Eric answered, and it was out of 15, and he scored 8 out of 15. And out of the problems questionnaire, he said that, he tended to smoke more on his own than he used to. If any of you have got a copy of the assessment, you'll see on page 9 where the problems questionnaire is, he crossed also that he worried about meeting people when he was stoned, that he spent more time with smoking friends than he used to, that he was in debt, that he was making excuses, that he had a persistent chest infection and cough. He driven while stoned, and this is what's got him in front of you. He was concerned about the lack of motivation. He's noticed that. And he felt less able to concentrate than usual. Now, you're not going to feed all of those back, but you're going to find some that you think are important to him. And just simply go, well, tell me more about that. Can you explain that a bit more to me? Or can you expand on that? You identified these, so why is that the kind of downside to your smoking? So that's what you might do with the problems questionnaires. Just find one or two or three, depending on your feel for that person, and reflect that back. And then, of course, there's the health questions, that persistent cough that he's always complaining about. And he may have some insight into say, well, I guess my health could be better, given my age and the stuff that I used to do, and now I've just got this terrible cough and find it hard breathing and so on. He may say that if asked. Now with the K10, he said that he was tired and that he was nervous or anxious and he felt worthless. And again, I think it's important for you to probe and ask him, can you expand on that a bit more? Why is that? Or why might that be? How long has this been going on for? Or what's going on in relation to whatever you want to pick out? So again, what do you think about all of that? What's going through your mind when we talk about things like that? And as we said, we're looking for recognition that perhaps, it's not as good, not as fantastic. There are some downsides and so on. And then the next little bit are the social implications of smoking, and you've picked those out of the assessment. And money is an issue, his girlfriend is an issue, he definitely wants to move out of house, he's not happy at all with the way he spends his time anymore, and he's a bit concerned that it may affect his work. It certainly affects the free time that he has, and again, he may be, you know, a bit upfront in terms of sex. You know, it's not as good as it used to be or something like that. Depends on how comfortable he feels talking about that. But money, personal issues, not happy where he's living at home, sex is an issue, work is an issue, and how he spends his free time. And then the legal question, obviously. Yeah, he got DUI, diversion, fine or a record is something that he's concerned about. And again, that's why he's come to see you. Okay, so let's go back now to the SDS and see in the video how that's expressed. And again, I just want you to listen out. If you can listen out for their interpretation, where, you know, she'll give a positive spin to the score, where there's a simple reflection, where there's a bit of reframing going on, where there's a double-sided reflection, where there's some insight. See if you can pick that out. Okay. Cue to the video, please.
So, Eric, the next section that we're going to be looking at is the severity of dependence scale. Do you remember we talked about the SDS last week?
Yeah, it's the dependency.
Yeah, that's right. And you answered 5 questions about your use.
Yeah, I kind of remember.
Great. So you told me that when you first started you only needed 1 cone and you felt good, you felt high, and this was really enjoyable. And however, now it takes at least 4 cones to get to the same sort of level. And we discussed that this may be an example of tolerance.
Yeah, well, that makes sense. I suppose if I keep chasing that high, I need to keep smoking if I want to chase it.
Yeah, that's right. So that's one of the ways that we measure dependence. So the other one was withdrawal. Do you remember what we talked about regarding withdrawal?
Yeah, it's like my headaches and stuff like that.
Yeah. That's exactly right. So you mentioned this happened when you couldn't get any cannabis. So you were talking about cold sweats and headaches and feeling really irritable, and that it sounded like most of these symptoms were unpleasant symptoms.
Yeah, definitely. I mean, the irritability is the worst, not being able to sit still,
yeah.
Sort of stuff.
So when you filled out your SDS, your score was 8. And the maximum score is 15, and the minimum for your age that suggests dependence would be 3. So how would you interpret your score of 8? I mean, what does that mean for you?
Well, that's pretty high. That's pretty shocking. It means I'm addicted, doesn't it?
Well, it suggests that you're likely to have a moderate level of dependence, so you are right. But the good news is that it's not 15 yet. So is there anything else that score gets you thinking about?
Well, I guess it means I rely on it. I need it. Maybe it'd be pretty hard to give up. You know, I thought that if I wanted to stop I could, but maybe it'd be hard.
Aha. You're surprised to hear you meet dependence. And you thought that it may be a lot easier to change.
Well, yeah. I mean, I know I get withdrawals and I've noticed that I need more, but there's definitely that tolerance we talked about. So, but I didn't think it'd be quite that high.
Okay, you always thought that you could stop at any time and that it was okay, it wasn't such a big deal. But now you're starting to question that.
Yeah, well, maybe I'm more addicted than I think.
You're starting to wonder if your cannabis use has gotten more out of hand than you thought. And maybe you're wondering if you'd be able to cope if you did make the decision to cut down?
Yeah. Well, I always thought I'd be able to cope, but maybe, well, I don't know. I guess it's got me thinking.
Yeah, well, I'm really glad to hear you thinking about it. I mean, this is the whole reason that we're going through this. It's really helpful to explore your relationship with cannabis and to see whether or not there are good reasons for you to cut down. Then you're able to make an informed decision. Anyway, we'll see how you go, and you can make your own decision now that you've got good information and a greater level of knowledge.
Yeah, that's fair enough.
Okay.
Alrighty. Okay, so were people, I guess this is an open question, were people able to identify those kind of MI questions and reflections? I'm glad I primed you. Now, I've been asked while we've been talking, I've been asked 2 questions that I'd really like to answer because I think they would help everybody. One question is, what happens in the case where the client is unable or unwilling to provide accurate details regarding the amount of cannabis that they use? Well, I just want to say 2 things. Primarily, here in this country, we really aren't afraid of disclosing what we use or what we do. We're pretty good at being fairly open. That's number one. The other thing relates to having established rapport and making sure that people feels extremely comfortable with you. And the more comfortable they feel, the more likely they are to be truthful. And when you ask them to fill out stuff, the more chance there is of them being truthful. However, if they're unable or unwilling to provide accurate details, you've got to go with what you've got. So, as said, you go with what you've got. And that's kind of made me think that I need to say that the SDS is absolutely based on a person's perception, okay? Now, you might know, given that you've asked quantity, frequency, duration, that they are in no doubt dependent. But if they go 0, 0, 0 or 1, 1, 1, and it's less than the cutoff, which is 3 or 4, depending on their age, now that is based entirely on their perception. I'm not sure that that's likely to happen. If you've invited them to do the ACCU, they've come back willingly to do the ACCU, you're telling them that in no way are you, wanting them to change or you're there to reduce or whatever. You're there just to explore the relationship between X and their cannabis use, and they can make up their own minds. And you preface the whole discussion with, this is kind of an exploration. The chances are that you won't get resistance. But as I said, you just need to go with the flow and just pick out what you know is important to them and feed that back. I hope that kind of answers the question. The other one, the other question is it worth talking about the amount of time spent on smoking? Absolutely, yes. Brilliant and well done. And there's also something else, particularly for those people who actually don't spend money on it, that they get it from their friends or from their parents or they grow their own. It doesn't necessarily cost their hip pocket anything. However, it costs them something. There are no free lunches. Everything costs you something. And I think I may have said whether it's sexual favours or giving somebody something, or even when it comes down to time, you need to feed that back and ask a question. So what else do you think you would have liked to have been doing with that time? So yes, 100%, I would definitely think it was worthwhile to feed that back. Thank you for that. Are there any questions at this point that you would like me to answer so far? I mean, again, it's important that this is for you guys, if you want to use the ACCU, that I clarify anything about it to in the hope that, you'll use it and see some merit in it. So if there are any questions, please just ask them. All right, so we've kind of looked at that and fed back some of the things that you've found more pertinent to feedback, and then we look at the anticipated consequences of reducing and increasing cannabis use. So you remember you prefaced, well, you used to, when you first started, you smoked X, then you went on to smoking 8 cones, and you've been smoking 8 cones for the last 5 years, and that's kind of gradually gone up to 8, sometimes more. So if you were to think about the next 3 years or 5 years, do you think there's a likelihood that you might increase given that you have? And if so, and now let's look at the cost of if you were to reduce your cannabis use instead of it increasing. But if you were to reduce your cannabis use over the next 3 or 4 years, what might that look like? What's the downside? And you may want to use the expected costs and benefits questionnaire on page 6 and 7, again, to pick out some things that you want to feed back. For example, I picked out, I might find myself more moody, I'd be more lonely, I'd be more anxious, bad-tempered, there'd be really strong urges to smoke, there'd be sleeping difficulty, I'd feel really crappy, I'd be bored, I'd miss the high. So, you don't need to feed back all of them, but you might want to feed back one and expand that a bit more. But they're the ones that I picked out and, as you can see, sent you. And then the benefits of reducing are also written there. You might want to pick 1 or 2 or all of them. I'd be able to think more clearly. Well, so why is that a benefit, Eric? Well, what are the good things about you being able to think more clearly? How's that a good thing for you? And I'd want to hear why he thinks that. And again, agree. Yeah, actually, now that you put it that way, I guess that would really be helpful when it comes to, extra study or needing to remember what you're measuring as a carpenter or whatever else in terms of memory and so on. The other things I pulled out was healthier, happier, there'd be less fights. Yeah, can you tell me, how that might translate into your day-to-day relationship with your girlfriend? What would that look like? Again, that might be expanded. You'd be more productive. You said that you'd have more energy. Can you tell me more about what you do with that energy? There'd be better job opportunities. Yeah. What else? Well, that would mean maybe more money and so on. So, you pick out and you use those as a springboard to kind of expand on those and get them to really weigh up. Perhaps there are some good things about reducing, perhaps even stopping. So that other question there, would this reduce your criminal activity? Well, obviously they're not engaged in criminal activity, but yes, he might, not be so worried when he's driving around stoned that he'd get picked up again, and in which case there would be more serious consequences. And so then you look at the flip side, as I said, the expected costs of increasing, and you preface that by going back, and now you're saying, well, chances are that you may not, but you might increase. And how would that look? What would that look like? And he would run through, he did run through some of the costs of increasing, and there were very little benefits that he could think of for increasing cannabis smoking. So just to finish off now, with the last couple of minutes that we have, I'll do this video again next week. We can talk a bit more about that, and you can think about some questions that you want to ask me, but we'll finish off with him being asked some questions about increasing cannabis use. Q2 video number, I think, 7, isn't it?
Okay, Eric. The next section goes through what we were talking about last week in terms of increasing your cannabis use. So what might the costs and benefits be of increasing your use? And you mentioned to me that one of the costs of increasing your smoking was that there would be more drama and conflict with your girlfriend.
And my parents.
Oh, and your parents. Because you'd have less time to spend with them, and you'd still be arguing just as much as now because, well, you'd be zoned out.
Yeah, that's exactly right.
And you also said that one of the benefits would be that you'd be smoking for longer to fill in the boredom. And you saw smoking for 6 hours as opposed to 4 hours as a really positive thing because you enjoy smoking and it's a hobby to you, and at the same time you saw it as destructive to your relationships.
Yeah, well, that's just because I really like smoking, but it is a double-edged sword. I mean, the more I smoke, the more trouble I am causing with my relationships, so it's not really a benefit.
You're right. So, unpacking this a little bit more, do you see any benefits from increasing your smoking from, say, 8 cones a day to like 12 or more cones a day?
Well, I guess not really.
Okay.
Yeah. Well, as you're saying before, I mean, I'm spending $8,000 on weed, and I could be spending that on something else, like a car or a holiday, and so I'm just kind of throwing it down the drain.
Yeah, right. Let's just isolate the financial costs since you've brought this up. So at the moment, mulling up, you're spending $8,000 a year smoking 8 cones a day. Based on that, if you increased your use to 12 cones a day, that figure comes up to over $12,000 a year. What are your thoughts about that?
Far out, that's scary, right? I mean, I never really had $8,000, and that's something I could be spending instead on a car or a holiday, so I guess I just never really added it up. It's like a quarter of my full-time wage. So a quarter of all the money you earn, you spend on one thing so that you can relieve boredom. Yeah, I guess so. And it's just going down the drain, so it's pretty bad, isn't it?
So you're not happy about the money you spend. You see it as wasted. Now, money is a really important issue for you to look at and for you to consider when it comes time to make an informed decision about whether you want to increase your cannabis use moving into the future.
Well, I don't know anybody who'd be happy spending $8,000 a year, and I've got nothing to show for it.
Okay, so that was that. I'll show that again next week. But in the meantime, as you can see, I've given you a filled out version of the feedback form. And have we sent them a clean version of the feedback form? Yeah. I will send you a clean version of the feedback form. And for, from now until next Wednesday, if you could just look at that and know exactly where to find the answers to those questions or that form in the assessment, again, you'll be better equipped. And in the assessment, you may see that at the top of each one of those numbers, or headings, sorry, it tells you where to actually put that information into the feedback form. I guess all I'm saying is if you could just sort of glance over that, just take 5-10 minutes to look at those two pieces of paper, the assessment and the form, so that you're more familiar with it. Remember, these were one of our objectives was to get you familiar with the resources that are related to the ACCU in the hope that you feel more comfortable in using it. So I hope that's been a little bit of a benefit today in terms of how the feedback is given, but we'll just wrap up on Wednesday. We'll just finish the feedback and I'll introduce you to the strategies and what you do at the end of the feedback and how you hope that a person decides that perhaps they do, but we also look at the people who don't and the people who aren't sure. So that's great. Again, really appreciate your time, and I do look forward to having you again log in on Wednesday where we can wrap up this series. Okay, everyone. Thanks, and talk to you Wednesday. Bye.